Welcome once again to Pacific Women's 6th Annual Learning Workshop. Today, our panel discussion will be on case management, a survivor-centered approach. And today's focus will be case management approach and services available for people who experience gender-based violence. And participants will take away from this session an increased understanding about survivor-centered approaches and learnings from research into family protection orders. Today on our panel, our discussion will be moderated by Ms. Mirriam Dogimab. She is the Papua New Guinea Country Manager, Pacific Women's Support Unit. Ms. Dogimab has extensive experience in program management and knowledge of the gender sector in PNG. Also on our panel today, Ms. Denga Ilave. Ms. Denga Ilave is the Lay Operations Director of Femili PNG, which she joined at its inception in 2014. Denga previously worked at or with MSF at the Angao Hospital Family Support Center as a mental health counselor from 2011 to 2013. Before that, she was a secondary school teacher in Rabaul and a curriculum development officer. On our panel as well, Sister Edith Namba. She is the Western Highlands Provincial Health Authority's Family Support Center Coordinator. And joining us from online, Dr. Judy Putt. She is a research fellow in the Department of Pacific Affairs at the Australian National University with a background in criminology and anthropology. She has been responsible for multiple projects on crime, justice, and safety. And also on our panel, our last panelist, Ms. Kinima Daniel. Ms. Kinima Daniel is the helpline manager for the One Talk Counseling Helpline Line, a free counseling and support helpline in PNG managed by Child Fund PNG in partnership with the CIMC FSVAC.
Welcome everyone to day 5. It's Friday, our last day for the Pacific Women Annual Learning Workshop, and it's been a great week. We had such a fabulous round of conversations, and this morning will be the same. So it's good to have you all join us this morning, people who are physically here, and also everyone who's joined us online and our provincial viewers. So this morning's panel represents a research institute which Dr. Judy Putt is representing, and services along the referral pathway, who will share their experiences on how they manage cases using the survivor-centered approach. So in yesterday morning's panel discussion, we had from Marcia Kalinos talking about the referral pathway. She described it as people helping people. So these are some of the faces of people helping people along the referral pathway, who are all seated here with me this morning, and I'm so honored to have them. And we will talk about case management, but we'll specifically focus on survivor-centered approach and what that means and looks like in service delivery in Papua New Guinea. So let me start our conversation by explaining briefly what a survivor-centered approach means. It is defined by the United Nations as one which seeks to empower the survivor by prioritizing their rights, needs, and wishes. This includes ensuring the survivors of gender-based violence, or here in Papua New Guinea, we refer also as family sexual violence, have access to appropriate, accessible, and quality services, like medical, police for safety and security, counseling, and legal and justice responses. So I will start by asking our panelists, the 3 panelists here. I'd like to start with you to briefly explain the role of your organization in supporting a survivor who's experiencing gender-based violence or family sexual violence. So I'll start with you, Sister Edith Namba. You work with the Western Highlands Provincial Health Authority, the Family Support Center. Could you explain to us what the Family Support Center does in terms of supporting survivors of gender-based violence.
Good morning, everyone. Thank you, Mirriam. First of all, what Family Support Center in Western Highlands Provincial Health Authority in the hospital does is that it provides the 5 essential services to the survivors of gender-based violence. And that includes sexual violence, physical assault, all forms of child abuse, economical abuse, physical abuse or verbal abuse as well. So the first service that we provide is we provide counseling. We provide, secondly, we provide all the medical interventions. Like, for example, for all the sexual violence cases, we provide post-exposure prophylaxis, and that's for prevention of HIV, prevention of STIs, prevention of unwanted or unintended pregnancy, and prevention of hepatitis B, tetanus. Those are the things that we prevent in terms of medical intervention. And of course, we do counseling for all survivors of gender-based violence. And also we do referral to all the stakeholders that we provide information and advice. And we only refer upon the choices that the survivor does, and also for the best interest of the survivor. Apart from that, we also provide medical report for those survivors who seek legal or who want to take legal actions for the violence that they go through. Apart from that, we do awareness, or we conduct awareness through media using the local radio, and also we conduct awareness throughout the communities in Western Highlands as well. And apart from our work that we do at the Family Support Center in terms of clinical work that we do, we acknowledge FHI 360 through default funds that we also provide extra services. We have a male advocate, men's desk, which provides couple counseling, as well as male who go through violence. That's one. And two, we provide children's playtime. We conduct children's playtime from the age of 5 to 10 years old, where we invite them monthly to come to Family Support Center to have a place. So we teach them on, basically, on simple things like not to talk to strangers and prevention of strategies to prevention of child sexual abuse. So we get all the children together to teach them on prevention of child sexual abuse and safety plan. Apart from that, we have monthly support group therapy, where we invite all the women who go through intimate partner violence to come together to share with each other so that they feel that they are not alone suffering. Basically that, and we do clinical case review for interesting cases that we get. But most of all, we have very good network or referral pathway with police, community development, and other partners in the province, that we ensure that the survivor is satisfied and is safe. Thank you.
Thank you, Sister Edith Namba. So it seems that the Family Support Center provides more than just clinical services. You offer a lot of counseling services and awareness raising as well. So speaking about counseling, I would like to move to Kinima. Child Fund operates the only hotline or phone counseling service service here in Papua New Guinea. Would you like to tell us a little bit more about that?
Thank you, Mirriam. It's an opportunity to talk about the services and also to give an overview and view on how and what is the important thing in working with women and children in Papua New Guinea. I'll just give an overview of Child Fund. For the viewers, Child Fund Papua New Guinea is registered as a local NGO under the Papua New Guinean Association Incorporated Act, working to reduce poverty for children in developing communities. Child Fund Papua New Guinea was established by Child Fund Australia, which is a member of Child Fund Alliance, a global network of 12 member organizations which assist almost 23 million children and their families in 70 countries. Child Fund Papua New Guinea began in 1994 and works in partnership to create community and system changes which enables vulnerable children and young people in all their diversity and to assert and realize their rights. So the projects are implemented in 7 provinces across the country in both rural and urban settings with focuses on mental, child health, nutrition, water and sanitation, education, and also child protection and resilience against family and sexual violence. Child Fund PNG also prioritize climate change and disaster preparedness. In 2015, Child Fund PNG established the country's first ever family and sexual violence counseling hotline, which operates in Port Moresby, but also provides national coverage for survivors in 22 provinces. Also, just to give you a rundown on what is the hotline or Wanto Counseling. Wanto Counseling Helping Line was established in 2015 by Child Fund PNG with the partnership from Family and Sexual Violence Action Committee. The helpline is the country's first ever family and sexual violence counseling hotline and operates out of Moresby. The core services of the project was to provide counseling, also to provide emergency support whenever it is needed. It is funded by New Zealand Ministry of Foreign Affairs and Trade and receive funding support from UN Women and UNICEF. And the helpline has been operating from 7 a.m. to 7 p.m., but now it has operated to 24 hours as we speak. Currently with the support from UNICEF and UN Women providing response to COVID emergency by strengthening provision for mental health and PSS support to children and parents caregivers. What is Wanto Counseling? In Tok Pigeon is a friend helping another friend. So it is a national toll-free helpline service. Anyone in PNG facing family and sexual violence or GBV, those witnessing it or needing information can call the toll-free line 715-08000. Counseling provided the support they need to calm the situation and get help. It is a free call for users of Digicel, and it is available 24 hours, 7 days a week, wherever you are in Papua New Guinea. You can reach the toll-free line. For other users, you can call the helpline or give a missed call and they can call you back. What service is provided by the helpline? Comprehensive counseling, referral service for survivors of family and sexual violence, needing PSS and MH, mental health support. Counseling, support and crisis counseling information. We do risk assessment, safety planning. We also do referral services, direct referrals, and information about where to access support. Mental health and psychological support to children, youth, parents, and caregivers. And you might be wondering who is going to call the helpline. Anyone experiencing family and sexual violence, GBV, or psychological stress, males and females, those that identify as transgenders, LGBT community, marginalized groups, adults, youths, and children. Anyone worried about someone else, you are a witness and you want to call on behalf of a friend or family member. Anyone who is a perpetrator of family and sexual violence can call the helpline. What type of referral support that is provided at the helpline? Family sexual violence units, we do refer to FSVU, family support centers in the hospitals, safe houses, repatriation, relocation services, sexual reproductive health services, VCT, ART, medical centers, welfare transport services, mental health, legal advice chats, especially for the village courts and all that, for IPO, or information on IPO, how to access IPO, family planning clinics, face-to-face counseling services. How does the helpline demonstrate a survivor-centered approach? We are guided by our minimum standard guidelines, principles, and professional code of conducts that guides our practice. The main principles that the helpline holds are the right to survival for women and children, the right to development, the right to participation, the right to protection. Telephone counseling are expected to provide non-judgmental and objective counseling. This requires the following. Counselors do not impose personal opinions on clients or survivors. Counselors are non-judgmental. Counselors accept clients, survivors for who they are and not what they want them to be. So those are also, we do have our code of ethics and the principles that we hold to ensure that legally and ethically we are working to ensure that the survivors are getting the right support that is needed. Thank you. Any questions? Then we can further clarify more.
Thanks, Kinima. I'd like to move to you, Denga, and want you to quickly talk to us about the Case Management Center and what it is and how it's been operating by Family PNG in PNG.
Okay, thank you. Firstly, I'd like to acknowledge all the service providers across the region in Papua New Guinea and individuals who provide assistance and support services to survivors of family and sexual violence, acknowledging the fact that it's not easy to work with survivors of family and sexual violence. So going to Family PNG runs the Case Management Center in Ilave for 7 years now, and we are also the operator of the Case Management Center under the Belisi PNG initiative, and also with the support from the Spotlight Initiative, we have an outpost of 2 case workers in Goroka. So we are working in those 3 provinces, but our support services within the Case Management Center is extended to survivors across the region as well, based on referrals that we receive. Now, within the case management services that we provide, and having said that the client-centered approach, it's not always easy to work with survivors. When you first engage with client, and then when you go through the process of case management, where we intake the client, and then we do assessment of the safety needs and security. Then we also do safety health assessment, their psychological assessment, and other assessments have been completed. And then we went on to do the care plans of the case workers, do those plans with the clients, and an implementation of the plans. And while the implementation of the action plan is being done, then we collaborate also with the service providers as well as the client's family. And then goes on to the implementation of the plans. And when it's implementation of the plans, within the process, the client's change in needs also arises as well. So sometimes you'll go back to the assessment again, then you work with the clients. So quite challenging when you actually do the case management work with the survivor. And then the monitoring and follow-up of the plan has been done. And during the monitoring, sometimes new needs arise and caseworkers have to establish new plans again with the survivors. And then if it goes on to receiving the services, then the caseworkers then do the monitoring, evaluation of how they work with the clients. And if it means to bring the case to a closure, they do. And so within the process, because of the changing needs of survivors that arises, it's not always easy having or supporting survivors to access their needs. And that is when, within the case management center, our case workers work with the rest of the service providers. So in order to provide case management services, Femili PNG cannot do it alone. We only assist the survivors to have access to the essential services that are provided by many of our government service providers, and also including other civil society organizations, faith-based organizations. And just going back to what our good governor made mention of yesterday when he spoke that the referral pathway is re-traumatizing the client, and how does the case management center or the case management services helps. So when a survivor is intake into the case management center, we acknowledge the fact that there are a lot of challenges faced by the survivor in actually having access to the services that are already there. So what our caseworkers do is to work with the clients. If they are illiterate, they are assisted to do their statements. If they cannot provide transport for themselves, that support is also provided to them. If they need refuge accommodation, that is also arranged by the caseworkers, not the Femili PNG provide. In Lay, we don't have a safe house. But we work with City Mission, Salvation Army. There are other NGOs and FBOs that provide that support. And also I'd like to make mention that because of the changing needs of the clients, when our caseworkers do assessment and identify safety and security risk, which is a major concern raised by many other partners in terms of service providers asking why is it that, a survivor has reached this point where you're already within the referral pathway, and how come that they were not assisted? How come that they were not protected? When those safety and security needs are identified, then the caseworkers, or we would put that forward to them, that these are the risks that is present, and the options are laid out for them. So there is support like refuge accommodation is there. You can also have the case reported to police. You have the perpetrator arrested. And we do understand that there are delays as well. But at the end of the day, we're talking about client-centered approach. Then it is based on the client to accept. If they want to be kept in the safe house for refuge accommodation, they are the ones to say that, yes, I acknowledge that I am at risk and I would like to be accommodated at the refuge accommodation.
Thanks, Denga, for that. I'd like to move to Dr. Putt, who's joining us online. One of the key services or demand for legal support for someone who's experiencing gender-based violence or family sexual violence is an interim protection order or a protection order. So before we talk about the research you've done on family protection order, could you quickly please explain for us the difference between an interim protection order and a protection order, and what does the protection order, what is the purpose of the protection order, and how does the protection order, what does it use for and how it works? Thank you. But basically what the difference between those two are.
Okay, sure. Before I do that, can I just say hello to the other panellists who have helped with so much with the research I've done in the last few years. There's also been a huge team of other researchers involved in the work as well, more than 25 local researchers and a couple of academics in PNG also help with the research. So I just wanted to acknowledge that. Yes, an interim protection order only lasts for 30 days. You can go back to the court, the district court or the village court, and ask for an extension for another 30 days. But as the name implies, it is only an interim order. It's very short term. The protection order is a much longer order, which the court can issue for, and when I say the court, only the district court, the village court can't do it, can be issued for up to 2 years. It doesn't have to be 2 years, but that's the longest it can be. The purpose of the protection orders that were introduced under the Family Protection Act is to say that certain kinds of behaviours are not acceptable, and that the person that's called the respondent, which is typically a man, has to comply with certain conditions set out in either the IPO, the Interim Protection Order, or the Protection Order. And this is to try and prevent any further violence, abuse, controlling behaviours, and so on. And if that respondent breaches the order, that is actually a criminal offence and can result in imprisonment and or a fine. But it's really essentially, the order is a deterrent. It's to say, look, the state of Papua New Guinea says this kind of behaviour, domestic violence, is not allowed. We know it's a criminal offence, but we're saying, look, in a way, we're giving you another chance here. These are certain things that you have to do or not do. But if you do continue to act in a certain way or for example, continue to harass the complainant, then you will be in breach of this order, and the full weight of the criminal law should be applied to you. Is that enough?
Yeah, I think that's
you do
clear.
I was about to say, you do find civil protection orders. There are these protection orders in some guise or another around the world, pretty much in many countries now. There was always questions about how well it would work in Papua New Guinea. So what our research was looking at was how much are being used and whether they seem to be effective. And I can say a little bit more about what we found out and how it relates to case management if you want me to.
Yep, I think you can continue and tell us what you found from the research and how that linked to especially case management of survivors. I know the study looked at the efficacy of the family protection order. And the study you've done, the one in 2019 to 2020, focused in Autonomous Region of Bougainville, Morobet, Jiwaka, Western Highlands, Oro, and here in NCD.
Yes, and we also got statistics from magisterial services on the number of IPOs that had been applied for, and for all of the district courts in Papua New Guinea in 2018. And that showed a lot of variability. So some places seem to have quite a few being issued, other places had none. So that is an important finding. And what the research highlighted from the 7 sites that we concentrated on was what a big difference having a specialist family and sexual violence service can make, like Femili PNG, because of their approach to how they support the survivors, means that they can, as Denga has said, help women apply for the orders, follow up with the court, follow up with the police. They really enable the survivor to continue to in a way that ensures that the survivor knows what to do and what can happen. So the case management approach is about providing the information, ensuring that's what the survivors want to do, the clients want to do, and then following up and advocating on their behalf, which is absolutely critical, to talk to other services, to people in the justice system, to find out what is happening and why there may not be any action. So what our research found in Lay certainly is there was a much higher rate of the IPOs, those interim short-term orders, being converted into those longer-term orders, the protection orders. In all the other locations, that was not likely to be the case. There were a lot of IPOs perhaps being issued where there was a specialist service to help the clients. But having that particular case management model and the kind of expertise that Femili PNG had, for example, and having an in-house lawyer, meant that there was that conversion to the much longer orders, which is a good outcome. Our research also found out, and this is very important and I think, is that for the majority of more than 100 survivors that were interviewed, who had applied for an IPO, that the majority, more than 80%, had felt safer and were safer as a result of getting an interim protection order. But once again, we found that for most of them, they hadn't then gone on to get a longer term order, and partly that was because they didn't know, some of them, that they could. Some of them assumed that the interim protection order was in place for a much longer period of time than what was the case. So I guess for us, the key finding really related to, yes, these can be a really important tool in the battle to reduce and prevent family and domestic violence, but that still quite a lot of work needs to be done to increase the take-up and the possibility of them being used in many locations across Papua New Guinea. The village courts, though they can issue IPOs, didn't seem to be doing so, and in our report we provide some reasons as to why that might be the case. But you can also find in certain locations the district court magistrate may not be particularly sympathetic, or the family and sexual violence unit, the police, may not be open or under risk. So it can be a lot of variability depending on where you are, the kind of services that are available, the key people who are in those places. So it's something more about trying to ensure that as many survivors as possible have that opportunity to apply for an order should they want to. But again, coming back to that case management model of not only being there over time for the survivor, but also that role of advocacy, which Denga has mentioned.
Thanks, Doctor. I'd like to move to Sister Edith Namba. And I want you to give us a little clarification, because you are actually providing services at the health facility. So our Minister for Health and HIV in the panel yesterday that we had them, he spoke about nurses and doctors treat like cases of gender-based violence or family sexual violence. but they cannot report that. Could you explain to us why that's not possible?
Thank you, Mirriam. He is correct in what he said, the minister, because we, under the law, we don't have the mandate to report any cases to police or community development or in terms of child abuse, because we don't have the law that permits us, the service providers, to report straight to them. But what we do, we have the referral network that is in place with our partners. So after providing all the services at the Family Support Center in terms of clinical as well as psychological support, we provide information and advice to the survivors of gender-based violence, and upon the advice that we give, they're the one who make the choice to be referred to different partners. And if they want to be referred to police or any other partners, then upon their request, we do referral. We have a common referral form that we fill, and we send them with the form to different partners. He's correct in what he's saying, what he said. Thank you.
Please go ahead, Denga.
I'd like to just add to what Dr. Judy Putt mentioned about the IPOs. The IPOs are mainly issued by the district court, and we acknowledge the challenges that are faced by the district courts throughout the region. And speaking especially for Lae, we have hundreds of IPO issued in the year, but it's not easy. And we also acknowledge the individual magistrate, like the Lae Provincial magistrate, which is who is Mr. Tapil, who sits behind the office, who also hear cases, and in fact, they hear hundreds of cases every day. And we really need the government to assist them. As per the LPA, we need specialist court to be established, like the Pikinini Court, Family Court, and also to resource the court. If IPO, if majority of our survivors come in either to the police, even if they report to FSVU, and they've been really physically assaulted, but most of them resort to the IPO as a measure that, you know, they would like to go back to the relationship, but they want the violence to stop, the abuse to stop. And if that is what most of our survivors want, including the 3,000 plus cases that Family PNG have assisted through our case management center in Lae, majority of the survivors come in want the protection order. If more of our survivors, if that's the option that they choose as a service that they would like to access from the government, then we call on the government to put more magistrates at the district court level. And also there are district courts throughout the country that are not really operating. So we get to have magistrates from let's say an example is Lae District Court. Then they are on court circuit and they'll go out to the other districts within the province. And so when they are on court circuits, then you have cases delayed. And when you talk about survivors and client-centered approach, as and when they need the service, they need to access it. And if you delay the service, when they need it, they will always change. So if they come today and say they want an IPO, they want it now because they need it now for their protection, for the protection of their children and for their family. But if we delay it 2 weeks' time, then they no longer need the IPO because when they needed it, we were not able to provide them. So that is why it's important to make services accessible and make the resources available so that as and when there is a need, they're able to have access to the service they need.
Thank you, Denga. Kinima, I also wanted to...
Could I just say something very briefly?
Sure.
Adding to what Denga said. We've found quite a few people through our research weren't aware that you can get an IPO protection order and still continue to live with a partner or a husband. It doesn't mean that you have to be separated. It's up to the applicant to say what kind of conditions would help them. So a number of the women that were interviewed in our research, and there were several men as well, who had applied for an IPO, they had asked for conditions that didn't necessarily mean that they were separated from their partner. But also just a further comment in terms of what Denga was saying about needing more magistrates. There's also the very critical role of the IPO clerk who works in the court, who deals with all the paperwork and really supports the magistrate with these matters. And there's only one allocated per district court. Now, if that person's away for whatever reason or is doing other duties, then that's another blockage in the system. But I'll stop now.
Thank you. Kinima and probably Sister Namba and Denga, you can also add to this. This is a question from one of our audience. Do most clients want to access justice, that is protection or safety, or that just to stop the violence? So Kinima, probably we'll start with you because the phone will be like the immediate point of contact. So what have you found at the hotline?
Yes, as a client wants to reach the services, that a very crisis situation, and they want to ensure that their needs are met, or the crisis that they're in, they want to ensure that it's done. And they call in to seek that assistance. So the most important thing is making the survivor aware of the needs that they really want and how they can access it. And the most important thing is most of the callers that they called, we've seen that they lack the information and also lack the knowledge of where the services are available, even in their provinces that they are calling in. Or even the services are available, but lack of accessibility because of the geographical locations that they are to get to the services which might be available for them. So in a crisis situation, a survivor needs to be emotionally stable, to understand the situation he or she is in at that very moment that she's calling, and what are the real needs that she may want to, because, and as Denga had said, you know, we need to know what their needs are and make goals, plans with them. So survivors sent that when the survivors call the helpline, and if they're in a crisis situation where a husband is, you know, with an ex or with a possession of something and wanting to be violent to the wife, and she's calling, at that moment she's in a crisis situation, so making her aware of the situation and how that she can get help and where she can get help, and whenever she needed, she can get assistance. And sometimes the services are not really available at that moment for her to seek the assistance that is needed. And for us, we have our limitations as well. And sometimes we are 24 hours, and most of the services do not operate at night times, 24-hour services. And most of the violence that occurs in between after 4 p.m., 5 p.m., when spouses, the family are home together, that's when most of the violence occurs. And those are the challenges that we face in terms of referring the survivors. So those, one of our recommendation also to the services available, having, can also have a point of contact so we can work together to ensure that we have, we are following through the survivors, the women that who are calling the helpline. At least we have a network where we can flag and let them know that survivors are calling in the night, so we can continue to provide that support during the day. So those are some of the challenges that we have seen with our service.
Thank you. I'd like Denga for you to answer this question as well.
Okay, thank you. To answer the question, a lot of survivors want the violence to stop. And in order to stop the violence, they need access to justice services, because they cannot stop it themselves, and they've come forward to report.
Thank you. This is a question from our physical audience here, and probably I'll start with you, Sister Edith Namba. For deaf women who have experienced violence, most of them don't seek help due to the lack of sign language interpreters. Do you think it is something that the organization should implement?
Thank you. I think definitely it should, because at the hospital we don't have sign languages, people who could assist us to really communicate with the deaf, and some of our survivors are mute as well. So for communication, it's very hard. So it would be very excellent if we could have trainers who can train, especially at the hospital, our nurses on sign language, so that our communication with survivors and also with the patients would be very easy to avoid incidents and accidents to happen. And also we want to get the information to the survivors. So how can we get the information to the survivors if we don't know how to communicate with them? So that's a very big loophole there, so we need to, gap that we need to fix. So I definitely agree that we should have trainers to train. Yeah, thank you.
Thank you. Thank you for that question. This question came from Goroka, and it's for you, Denga. They want to know, how expensive is it to support a high-risk survivor in your case management work? How expensive is it to support a high-risk survivor until justice is served? This is from when they get a medical report from the Family Support Center to the when they go to the police to get their case reported at the Family Sexual Violence Unit until justice is served. Could you give us a sense of that?
It can be expensive. Acknowledging the context in which we work, where not all the essential services are accessible at the time and when you need. But there are instances where we have various cases that we work with, and if the services are available and accessible, then it's good for the survivor, as well as the case management center. But in most cases, depending on the number of people involved, when a mother is at high risk, sometimes the rest of her children are also at risk, and even her parents and family can be at risk as well. And then when you try to refer to the refuge accommodation that is provided by mostly the FBOs and other NGOs, then because of the amount of risk involved, then those organizations or the managers and staff operating the safe house can be also further put at risk. So considering those risks, a lot of times we try to put them at paid accommodation. And you can imagine the cost of paid accommodation in our country. And then while they are also at the paid accommodation, you provide the rest of the basic needs. And then because we are NGO and our vehicles can be easily identified, and we can be also followed by the perpetrator, putting the rest of our staff at risk, there are instances where we use rental cars. And there are times when the police is there to assist us, but also they are responding to many other cases out there. So there are instances when they are not available to do the transport for these high-risk cases. We use other rental cars as well. So in terms of managing high-risk cases, it's quite expensive.
Thank you, Denga. Dr. Putt, I think this question you will be able to answer and probably speak from research. What happens to these survivors that have turned for help and submitted IPOs, but did not get any feedback in relation to their IPO application? Do they still get to check up and follow up of the cases, or what happens? What have you found in terms of the research on family protection order?
That's the importance of having a service like Femili PNG and other NGO services, that they can, because they already have an established working relationship with the court, then they can all follow up on behalf of their client. Where there isn't a service, it is very much then left up to the survivor to try and find out what's going on, and I know that can be very costly. There are examples that we encountered of women they lived out in villages and having to come into the Provincial centre several times trying to find out what was happening with their IPO was really difficult. And during that time, feeling quite fearful as well. It's also important that the IPO is served on the respondent, on the person that the order is against. And really the police should be doing that, but in a lot of instances, the survivors themselves are handing over the piece of paper to say the order is in existence, and that can be a terrible time of risk. So again, where there is a specialist service, a caseworker to be with the survivor when that happens, that's really, really important. Sometimes the paperwork does go missing, and then it's a matter of applying for an order again, which can be very, very frustrating. But if you have a very sympathetic and aware magistrate, like who Denga mentioned, Mr. Tapo, it can make such a difference. Certainly a recommendation that came out of our research was looking at trying to improve the knowledge and understanding of these orders amongst magistrates, and because some of them seem to think it was more like a criminal matter and they had to wait until they hear from the respondent, from the person the order is meant to be against, before the order could be issued. So that could create long, long delays. Now that's not the case. As Denga has emphasised, these interim protection orders are meant to be issued as quickly as possible. So enabling or trying to encourage magistrates to be aware of the purpose of these orders, but also emphasising that they don't need proof or evidence to issue the order. It's based on the statement of the applicant is very important. And another thing relates to the village courts, who, as we know, are vital for so many people in PNG who don't have access to district courts, who are only in provincial centres, and not many of them do the circuit courts that Denga referred to. In fact, I think only one or two. So the village courts, that really needs to be looked at a lot more closely. The village court magistrates we spoke to said we already issue preventative orders. Why would we bother with these IPOs? And there seemed to be a lack of interest and not seeing why. I know some training's been done around this, but I'm not sure whether that will convert into the village court magistrates actually issuing IPOs.
Thank you, Doctor. I note that I have 5 minutes left, and I'm sorry, I apologize for everyone who's given questions and we're not able to go through all the questions.
Can I say something on that? On what?
In this 1 minute when we finish, I would like each of the panelists, especially the three of you here in front, there's a question online that asked, so you are providing all these services, you every day working with someone who is experiencing trauma and managing their cases, but how do you take care of yourself? How do you take care of your well-being and your mental health? So quickly, should we start with Sister Edith, Namba, Kinima, and Denga?
Thank you.
And then I'll summarize.
I think that's a very good comment or question. And we've been, as service providers at the Family Support Center, we've been raising this with our partners. And we go through a term that is being used as vicarious trauma. We go through traumatizing ourselves by listening to all these stories. It's not like you're seeing it on radio or you're hearing it from somebody else, but you're actually hearing it from the person, the survivor themselves, and that's really traumatizing. We sometimes go back home and we are traumatized, so we try to put the pressure on our kids, our family. Unfortunately, we don't have a professional counselor that could counsel us so that we can be counseled, and our mental state is very important too. So, yeah.
Kinima, quickly.
For the helpline, we do have processes in place, and we do self-care. Self-care is the most important thing, that you can look after yourself, and it's not that you can pay for it. There are other things that you can do that can relieve you from that. But because we do have counselors available, we have senior counselors to work on high-risk cases and brief through it so that we are mentally okay, because we want to deal with survivors. But self-care is the most important thing. Any listeners out there, you're working with survivors and really need to, you need to look after yourself, and self-care is not that expensive. You cannot buy it. Those are some activities that you can do that can refresh you or recharge you to help you to continue working with the survivors.
Thank you. Denga?
Thank you. Very important question. Quite challenging work. So in terms of within the organization, Family PNG provide support. We do have supervisors responsible to supervise staff, and if they are seen to be managing cases that are very traumatizing, caseworkers and our staff are informed that they can always refer to their supervisor or hand the case over to another staff who can be able to manage the case. In instances where caseworker have managed a very high-risk case, then we also call for a debriefing time with the supervisor or the manager, so that there is a time where the caseworker sits with the manager to go through a debriefing, what was challenging and how the caseworker sees there any impact on the caseworkers' personal lives as well. That's also been assessed and supported. We also have case conferencing. If a case is challenging, then the caseworker reports to the supervisor. And also we call case conference, which is a way of supporting the caseworker to manage any challenging case. And also we have case discussion where respective supervisors and managers sit as well. But for the whole project, we also do staff care programs. Like we would take the whole staff one day out in a month where we just go for a boat ride to Salamoa, have a swim out there for the whole day, go to the river and allow the staff to just swim away in the river. Yeah, so we, as service providers out there, encourage every department to work in this space to at least have established activities that can also provide that support to staff, because it's quite challenging work.
Thank you. And I would like to thank all our panelists this morning, Dr. Putt, who's joined us online, Sister Edith Namba from Western Highlands Provincial Health Authority, and Kinima Daniels from Child Fund, and Denga Ilave from Family PNG. I think the key message from all our panelists this morning is that for a survivor-centered approach to be effective, it relies on the referral pathway, and there is no fixed plan for a client or a survivor. It changes as the circumstances changes and the needs of the client changes. So service providers are always has to be flexible because of the client's needs being changed. And I think overall we've had that as all service providers, they need each other to be able to effectively provide a service that is needed by the client. So thank you everyone who's joined us. Thank you for all the questions. Just a final comment I want to make is that a lot of questions came in relation to counseling. We will have a counseling session this afternoon that will be facilitated by the PNG Counseling Association, so it's good to see questions around that. Please join that session in the afternoon and you can learn more about that.